Triazolam is a benzodiazepine used for short-term treatment of insomnia. In this video, let's find. What is triazolam? What is triazolam used for? Contraindication. What are the side effects of taking triazolam? How does triazolam work? How to use triazolam? What is triazolam? Triazolam, sold under the brand name Halcion among others, is a central nervous system depressant tranquilizer of the triazolobenzodiazepine class, which are benzodiazepine derivatives. Triazolam was initially patented in 1970 and went on sale in the United States in 1982. In 2017, it was the 289th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is triazolam used for? For the short-term treatment of insomnia. Contraindication. Halcion is contraindicated in patients with known hypersensitivity to triazolam, any of component of Halcion, or other benzodiazepines. Reactions consistent with angioedema, involving the tongue, glottis, or larynx, dyspnea, and throat closing have been reported and may be fatal. Side effects. Adverse drug reactions associated with the use of triazolam include relatively common, greater than 1% of patients, somnolence, dizziness, feeling of lightness, coordination problems. Less common, 0.9% to 0.5% of patients, euphoria, tachycardia, tiredness, confusional states/memory impairment, cramps/pain, depression, visual disturbances. Rare, less than 0.5% of patients, constipation, taste alteration, diarrhea, dry mouth, dermatitis/allergy, dreams/nightmares, insomnia, paresthesia, tinnitus, dysesthesia, weakness, congestion. Pharmacodynamic. A short-acting benzodiazepine used as a hypnotic agent in the treatment of insomnia. Some countries temporarily withdrew triazolam from the market because of concerns about adverse reactions, mostly psychological, associated with higher dose ranges. Its use at lower doses with appropriate care and labeling has been reaffirmed by the FDA and most other countries. Triazolam has a shorter half-life than chlordiazepoxide, flurazepam, and prazepam and does not generate active metabolites. Mechanism of action. Benzodiazepines bind nonspecifically to benzodiazepine receptors BNZ1, which mediates sleep, and BNZ2, which affects muscle relaxation, anticonvulsant activity, motor coordination, and memory. As benzodiazepine receptors are thought to be coupled to gamma-aminobutyric acid A, GABA, receptors, this enhances the effects of GABA by increasing GABA affinity for the GABA receptor. Binding of GABA to the site opens the chloride channel, resulting in a hyperpolarized cell membrane that prevents further excitation of the cell. Half-life. 1.5 to 5.5 hours. Dose. Insomnia. 0.125 to 0.25 milligrams POQHS. Maximum dose, 0.5 milligrams POQHS. Safety advice. Advice and warnings for the use of triazolam, Halcion, during pregnancy. FDA Pregnancy Category X, not for use in pregnancy. That's all the information about triazolam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.